Hello everyone. I hope I am clearly visible, audible to you people. Let me confirm it once. If I am clearly visible, audible, I will start the lecture ahead. Give me a second. Okay. So yes, I hope it is working. So a very good morning to all of you. I welcome you all for today's session. I am Dr. Priyanka Sachdev here, and today I am here to teach you a approach towards anemia. A patient of anemia is coming to you with hemoglobin less than the normal range for that person, for that age and for that gender. So what will be your approach? What is the diagnosis? How you will make the diagnosis of particular anemia? All anemias, hemoglobin is less than normal for that particular person, for that particular age and for that particular gender, right? So hemoglobin is less. You are doing a CBC and hemoglobin is less. Patient will complain of lethargy and fatigue and all. So what is your diagnosis? What is your approach towards the diagnosis? Whether it is iron deficiency anemia or it is some hemolytic anemia or it is some megaloblastic anemia. So treatment of all anemia is different. So before giving the treatment, you should make a diagnosis, right? If it is iron deficiency anemia, you have to give iron in treatment, of course. If it is megaloblastic anemia, you have to give vitamin B12 or folic acid in treatment, not iron. If it is sideroblastic anemia, iron is contraindicated. You can't give iron. If it is thalassemia, iron is contraindicated. You can't give iron. So before treating a patient of anemia, you should be firm about your diagnosis. That's my approach towards a case of anemia is really important. It is not necessary that anemia is always iron deficiency anemia. I know iron deficiency anemia is the most common anemia in India as well as the world, but it is not always the case of iron deficiency anemia, right? So how you will approach? Okay, so first of all, it is a small lecture. So I will teach you today only approach and classification of the anemia. After that, from tomorrow onwards, daily we will study one anemia, right? So iron deficiency anemia, megaloblastic anemia, sideroblastic anemia, thalassemia, sickle cell anemia, and all hemolytic anemias. So these are 6-7 important anemias from which question come in your NEET PG. So all the anemias are very important for your NEET PG. Okay. So without wasting time, let me start with anemia. So these are the things you should know about anemia. What is anemia? Let's define anemia. So what is the definition which is written in Robbins, right? So we will consider Robbins as our Bible. So we will consider all the definitions given in Robin line to line. We will understand them. We will not mug it, but we will understand it. So anemia in Robbins, it is written as anemia is defined as reduction in total RBC mass below the normal limit. So it is reduction in RBC mass. What is the RBC mass? What is how many RBCs a normal human being have? So the number of RBC, if you ask, it is 4.5 to 5.5 million per deciliter. So it will create a mass. The mass is known as packed cell volume. If is reduction in total RBC mass for a particular person for below the normal limits, it is known as anemia. But measuring RBC mass is difficult. Now RBC mass is directly proportional to hemoglobin. Jitna RBC hoga utna hemoglobin hoga. That's why we consider hemoglobin as a secondary factor to diagnose anemia. So in Robbins, it is not written that reduction in hemoglobin is anemia. Please remember, it is reduction in RBC mass is known as anemia, not reduction in hemoglobin. But we consider that RBC mass is directly proportional to hemoglobin. It is difficult to measure RBC mass. That's why we measure hemoglobin. So we measure hemoglobin. But in practice, the measurement of RBC mass is not easy, and anemia is usually diagnosed based on reduction in hemoglobin. So the definition contains reduction in RBC mass. But practically, we do not measure RBC mass for diagnosing anemia. Measuring hemoglobin is easier as compared to measuring RBC mass. So we measure hemoglobin, and reduction in hemoglobin is considered as anemia. So what is anemia? We practically what we do, anemia is defined as reduced hemoglobin concentration below what? Below what? Below the lower limit normal range for that particular age and sex. Now for particular age and sex, the hemoglobin normal range is different. Listen, please understand the normal limit. For males, it is 13 gram. 13 gram. If any male having hemoglobin less than 13 gram, he is anemic. If any female having hemoglobin 11.5, less than 11.5 gram, she is anemic, right? And if any newborn having hemoglobin less than 15 gram, less than 15, the newborn is anemic. Now, I want to ask you a question. You have to answer. I want to ask you a question to all of you. You tell me there is a person. There is a person. I'm not telling you age and sex of the person. There is a person having hemoglobin 12. 12 gram per deciliter. My question to you, whether the person is anemic, yes or no? Whether the person is anemic, yes or no? Anyone wants to answer? So it is a simple question. Hemoglobin 12 hai. Hemoglobin is 12. So whether the person is anemic, yes or no? Just tell me that. Whether the person is anemic, yes or no? Yes. Yes, Debraj. Whether the person is anemic, yes or no? Would you like to tell me? So whether the person is anemic, yes or no. So you can't tell that. You have to ask me, madam, we cannot tell whether this person is anemic, yes or no. First, you have to tell the age and sex of the person. If you say that this 12 gram per deciliter, this person is a male, so he is a anemic male, anemic. So he is having anemia because the normal range for him is 13 and 12 is below 13. And if you say she is a female, this person is she is not anemic. She is normal. She is normal. She is not anemic because the normal range is 11.5 and 12 is more than 11.5. So we cannot say, Debraj, we cannot say. So you should know the age and sex of the person, and both of them are adults. Huh? Male or female, मैंने adults बोला है, adults. If I say male or female newborn है, तो of course both of them are anemic, क्योंकि newborn के लिए normal range 15 है. So you should know the cutoff. There is not one cutoff, Debraj. There is not one cutoff कि I will say कि इससे नीचे anemia है. For male, adult male, it is different. For adult female, it is different. And for newborn, it is different. That's why before defining anemia based on hemoglobin only, first you have to see the age and gender of the person. Based on the age and gender only, you can decide along with the hemoglobin concentration. You can decide whether the person is anemic, yes or no. Have you got it? Have you got it? Those who are listening, have you got it? Debraj and others, have you got it? So this is the definition of anemia. Now read the definition of anemia, you will get it. So it is reduced hemoglobin concentration below the lower limit, which is normal for that age and sex. So if it is a male, it should be below 13. If it is female, it should be below 11.5. And it is a newborn, it should be below 15. So for that age and sex, what is normal lower limit? Uske niche it is anemia. Have you got it? So this is the definition of anemia. We got the definition. There are some symptoms which are common for all anemias. All anemias. So whether it is iron deficiency anemia, megaloblastic anemia, hemolytic anemia, these symptoms are common, and some symptoms are peculiar for particular anemia. So common symptoms मैं एक बार बता देती हूँ, and the particular symptoms I will teach you particularly when I will teach you that anemia. Okay. So what are the common symptoms? The patient will feel tired always. The person will feel tiredness, fatigability, lethargy, generalized muscular weakness, lethargy and headache. So these are the common features. Why all these features are there? Because hemoglobin is less now. RBC mass is less, hemoglobin is less, and hemoglobin is required for oxygen transport. So oxygen, relatively oxygen will be less in the body. So less oxygen, so less ATP, less ATP, less mitochondrial, the mitochondrial electron change and chain, and less ATP will be there. So patient will feel tiredness because ATP are less relatively. Fatigability, headache, lethargy, weakness, ये सब चीजें होंगी symptoms. And signs, what about signs? Symptoms are the things patient will tell you. Signs are the things that you have to examine. You have to examine in that particular person. So the first thing you will see pallor. It is the most common and characteristic sign. What do you mean by pallor? What do you mean by pallor? Pallor is seen on mucosal membranes. On mucosal membrane pe, we will see the color of the mucosal membrane. Normally, mucosal membranes look pink in color because it contains adequate hemoglobin. But if hemoglobin is less, they are less pink. They are less pink, relatively whitish there. So we see either the tongue is relatively less pink, less red, less pink, or a little bit whitish you can say, or we see the conjunctiva, not the sclera, ye conjunctiva. We see the conjunctiva. So it is less pink. So we see either tongue or conjunctiva. We don't see sclera, right? Here sclera is seen in jaundice. Sclera is seen in jaundice. The jaundice में ये yellowish हो जाती है. So we see the mucosal membrane and we see the pallor. Pallor is seen on the mucous membrane, conjunctiva, and on the relatively on the skin. So that is the most characteristic sign. So you can see here, these are the symptoms. So there is no pallor. Compare it. Can you compare? What Debraj is asking, in person having high altitude, will they have hemoglobin high? So I will come on that. So that is the you're talking about accommodation, acclimatization. I will come on that, Debraj. It is a topic. It is a topic. Post COVID, why persons are suffering from IDA. I mean, so that is a topic related to COVID. Let me finish this. I will answer both of your questions, Devraj. Listen. So compare the pilar. See the conjunctiva of normal person and see the conjunctiva here. You will understand what is pilar. See the tongue of a normal person and see the tongue of an anemic person. Compare the conjunctiva. Compare the tongue. You can see the nails. Nails maybe there is pilar. You can see. You can see pale nails. Nails maybe आप pilar दे सकते हो. This is normal. See this reddishness and see this whitish nails. And see the palms, these are reddish, these are whitish. So you can see pilar here and you can compare the pilar everywhere. Give me a thumbs up if you got it. Give me a thumbs up. So these are the symptoms and signs, the important symptoms. The sign is most important is pilar. The other signs are system wise. So let me come on the approach, classification and approach of anemia. That is my topic, the most important. Let me first teach you classification of anemia. How we classify anemias. We classify anemias by two ways, morphological and etiological. Etiological means pathophysiological. So let me first teach you morphologically only three types of anemia are there. Pathophysiologically, we divide it into three columns but with multiple anemias inside them. I will come and then in the end I will compile the two classification. Let me first tell you morphological classification. Morphologically, only three types of anemia is there. Microcytic hypochromic, normocytic normochromic and macrocytic normochromic. So students always have confusion in them. So for the students who have confusion in them, for them I am telling you cytic. The term cytic मतलब होता है size और chromic the term chromic मतलब होता है color. So you have to see two things in RBC, the size of RBC and color of RBC. So do you know normal size of RBC? It is 7 micrometer, the diameter of RBC. Do you know normal color? Normal color क्या होता है? So this is a RBC. The size is 7 micrometer diameter. This is normal. And if you talk about RBC color, so this is a RBC. The hemoglobin, there is no nucleus in RBC. We know the hemoglobin is present at the periphery. So peripheral 2/3 is filled with hemoglobin. That's why peripheral 2/3 is red in color. It is red or pink in color, and central 1/3. Central 1/3 is white in color. It is known as central pilar. White matlab pilar. So central 1/3 is pilar and peripheral 2/3 is red. So this is normal color. ये normal color है और ये normal size है. First understand what is normal size and what is normal color. So this is normal size and color. Cytic matlab size and chromic matlab color. Now we will see two things. We will see. Now how you will compare the size. Just suppose, listen, there is a person, he is complaining of dyspnea, lethargy. Okay, so you are suspecting he is having anemia. So what you have done, you have taken the blood sample in a test tube. This is the blood sample and you have applied CBC. In the CBC, the person is having hemoglobin 7 gram per deciliter. So of course, whether male, female, newborn, he is anemic. The person is anemic. Now which anemia? So what I will do, I will make a slide of it. So I will take one drop on a slide. This is one drop of the blood on a slide and I will make a smear of it. So multiple RBCs are there on the smear. I will examine the slide under microscope. So how I cannot take the scale and measure each and every RBC whether the diameter is 7 micrometer, yes or no. So how I will measure the size? No, on the smear. Lymphocytes are also present. These are the lymphocytes. These are also present along with RBC. So the lymphocyte is also 7 micrometer. Lymphocyte तो हमेशा 7 ही रहेंगे. But size of RBC can differ according to anemia. So we will grossly compare the size of RBC with lymphocyte. So whether RBC is smaller than lymphocyte, larger than lymphocyte, or same as lymphocyte. So lymphocyte is 7 micrometer we will consider. So this is the criteria how we compare the size of RBC, yes Debraj, with that of lymphocyte. So see the three slides are in front of you. In the three slides I am marking lymphocyte for you. This is a lymphocyte. Okay, let me use this color. This is a lymphocyte in the slide. This is a lymphocyte in this slide and this is a lymphocyte in this slide. Do you have any problem? Now compare. I'm marking RBCs for you. So see, this is a RBC, 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 RBC. Here, see the RBCs. See the RBCs. See the RBCs and here see the RBCs. Now compare the size of these all RBCs with one lymphocyte in each of them. Okay, let me talk about the first slide. In first slide, the RBCs are smaller than lymphocyte. Lymphocyte तो हमेशा 7 ही रहेंगे. But size of RBC is 7 micrometer. Lymphocyte तो हमेशा 7 ही रहेंगे. But size of RBC is 7 micrometer. Lymphocyte तो हमेशा 7 ही रहेंगे. But size of RBC is 7 micrometer. Lymphocyte तो हमेशा 7 ही रहेंगे. But size of RBC is 7 micrometer. Lymphocyte तो हमेशा 7 ही रहेंगे. But size of RBC is 7 micrometer. Lymphocyte तो हमेशा 7 ही रहेंगे. But size of RBC is 7 micrometer. Lymphocyte तो हमेशा 7 ही रहेंगे. But size of RBC is 7 micrometer. Lymphocyte तो हमेशा 7 ही रहेंगे. But size of RBC is 7 micrometer. Lymphocyte तो हमेशा 7 ही रहेंगे. But size of RBC is 7 micrometer. Lymphocyte तो हमेशा 7 ही रहेंगे. But si lymphocyte. And if you see the color of the RBC, see any RBC. Let me mark one for you. Or the central pillar is enlarged. Peripheral two-third color is less. Color is less, and central pillar बढ़ गया. So it is microcytic. Can I say it is microcytic? मतलब size भी कम है और hypochromic, color भी कम है. Size and color both is less. So it is microcytic, hypochromic. See the second one. It compare the size. The size is bigger. Size is bigger. So it is macrocytic. Cytic मतलब size. लेकिन color is normal. So it is macrocytic, normochromic. It is peripheral two-third filled with red color. Central one-third is pellar. You can see in any RBC. And third is size and color both are normal. Still the patient is anemic. So normocytic, normochromic. Have you got it? Debraj, have you got it? So three things are there. Roshan, have you got it? So three things are there. You have to see the size of RBC and you have to see the color of RBC. You have to see two things. Size matlab cytic and color matlab chromic. Please learn these terms. So size and color. So the first type of anemia is microcytic and hypochromic. Hypochromic. Microcytic, hypochromic. That is size is less, color is less. That is the first type of anemia. The second type of anemia is normocytic, normochromic. So size and color both is normal. Still the patient is anemic. The third type is macro. This is normal. Size and color both are normal. Third is macrocytic. Size is more, but color is never more. Color will remain normal only. So macrocytic, normocytic. So say the three types of anemia. Anyone will help me? It is less. That is microcytic, hypochromic. It is normal. That is normocytic, normochromic. It is more. Size is more, but color is normal. So macrocytic but normochromic. Give me a thumbs up. So these are the three types of anemia in front of you. So this is the first you have to decide तीनों में से कौन सा है. Microcytic, hypochromic, normocytic, normochromic कि macrocytic, normochromic. Give me a thumbs up. Have you got it? Now which anemia is of which type? Just a second. Give me 1 minute. So you have to decide on the slide. So there are 4 mnemonics for you. Just suppose the anemia is microcytic, hypochromic, or macrocytic, normochromic, or normocytic, normochromic. The three types of anemia. Then which anemia falls under which category? Microcytic दुनिया में सिर्फ 4 ही anemia होते हैं. Only 4 anemias are microcytic, hypochromic. The mnemonic is SITA. SITA. SITA is the mnemonic. So sideroblastic anemia, I से iron deficiency anemia, T से thalassemia और A से anemia of chronic disease. So SITA is microcytic. You can learn like that. It is microcytic, hypochromic. Only 4 anemias in the world. So if your slide is showing microcytic, hypochromic, patient must have out of this 4. One of the anemia out of this 4. तो 4 ही ऑप्शन है. अब इन चारों में से कौन सा है? Further investigations we will do. Give me a thumbs up. If it is macrocytic, again you have only 4 options. Lady Harding Medical College, LHMC. So liver disease, either the patient is cirrhotic, alcoholic and cirrhotic, or hypothyroidism, or megaloblastic anemia, folic acid or vitamin B12 deficiency, or cytotoxic drugs like methotrexate and phenytoin. So Lady Harding. So if it is macrocytic, one of the 4 cause is there, not the 5th one. इन चारों में से ही कुछ ना कुछ होगा. माइक्रोसिटिक है तो इन चारों में से कुछ होगा, मैक्रोसिटिक है तो इन चारों में से कुछ होगा. नॉर्मोसिटिक है तो if the person is normocytic, so you have to see for retic count. Retic count is high or retic count is low. If retic count is high, it is hemolytic anemia. Hemolytic anemias have normocytic with high retic count. So there is a mnemonic. The mnemonic is SHAPE, SHAPE. So all 5 hemolytic anemias, you know, sickle cell anemia, hereditary spherocytosis, A से autoimmune hemolytic anemia, P से paroxysmal nocturnal hemoglobinuria, PNH, और E से enzyme deficiency, that is G6PD deficiency. So all 5 hemolytic anemias. And if it is normocytic but retic count is low, so it is not hemolytic anemia. So mnemonic is Ramchandra. यहाँ सीता थी, यहाँ पे रामचंद्र है. So renal failure, anemia of chronic disease, AOCD, right? Myelofibrosis or cancers. Give me a thumbs up. So if any anemic patient is coming to you having hemoglobin less than normal, make a smear, make a peripheral smear and decide whether the person is microcytic, whether the person is macrocytic, or whether the person is normocytic. If it is normocytic, see the retic count is low or retic count is high. Then decide your options. If it is microcytic, the options are SITA. If it is macrocytic, the options are Lady Harding Medical College, LHMC. If it is normocytic with high retic count, it is hemolytic anemia. So the mnemonic is SHAPE, SHAPE. normocytic but low retic count, it is Ramchandra. Give me a thumbs up. If you want me to say the full forms, here are the full forms. See, everyone see. So, Sita, sideroblastic anemia, iron deficiency anemia, thalassemia, anemia of chronic disease. It is macrocytic anemia, it is liver disease, cirrhosis, hypothyroidism, megaloblastic anemia, vitamin B12 and folic acid deficiency, and cytotoxic drugs like methotrexate and phenytoin. If it is normocytic with high retic count, all hemolytic anemias, sickle cell anemia, hereditary spherocytosis, autoimmune hemolytic anemia, PNH, paroxysmal nocturnal hemoglobinuria, and enzyme deficiencies, that is G6PD deficiency. If it is normocytic with low retic count, it is renal disease, anemia of chronic disease, right? M से आपका हो जाएगा, M से क्या है? C से cancers, M से myelofibrosis. So please learn. This is the approach to anemia. So I'm done. Thank you very much for being with. It was a small lecture. Okay. So just a second. Just a second. Okay. So let me announce my schedule ahead. So we have launched a series for you guys. All those students who are targeting NEET 2022, NEET 2022, which is going to happen in this March, right? For them, we have launched a series, the Concord NEET PG, in which we will cover only important and difficult topics here. So I have started. So today is the first day of the series. So complete December and complete Jan. For the next 60 days, you will be with us and we will complete on this channel, YouTube channel, we will complete all important difficult topics of all subjects which are important for NEET PG 2022. So it was the first lecture today. So don't worry, we will continue the lecture tomorrow and daily we will have a class. So today it was a half an hour class only, 9 to 10, 9 to 9:30. Tomorrow 1 hour class, daily 9 to 10 a.m. in the morning. Daily we will have a class. So tomorrow I will teach you first anemia, iron deficiency anemia. And next day, megaloblastic anemia. Uske baad all hemolytic anemias. So 1 hour daily you have to give your time to me. So thank you very much. On Unacademy, we have two types of subscription, plus subscription and iconic subscription. These are the prices of various subscription you can check. So you can check plus, iconic. These are the various plan along with the various prices. You can select the plan which best fits to you, right? On all the plans, you will get 10% discount if you apply my code Sachdev10. Thank you very much for being with me. And I will be tomorrow. I will be there tomorrow on this YouTube channel only at 9 a.m. But tomorrow's lecture will be large 9 to 10. Thank you very much. Thank you very much.